Before I say another word, I need you to understand something. If you're taking omega-3 fish oil every single day, thinking you're doing something good for your heart, and you're also on one of the 2 medications I'm about to name, you may be silently raising your risk of a stroke without even knowing it. I've been practicing cardiology long enough to have seen this exact mistake send people to the emergency room. People who were doing everything they thought was right. They were eating clean. They were taking their supplements. They were following advice they read online or heard from a neighbor. And none of them, not a single one, realized that the combination sitting in their medicine cabinet was working against them from the inside. I'm Dr. David, and today I'm going to tell you exactly what those 2 medications are, why the interaction is real, and what millions of older Americans are doing every morning without realizing the quiet danger they've created in their own bloodstream. Stay with me, because what I'm about to explain could genuinely protect you or someone you love. Let me be honest with you from the start. I'm not here to scare you into throwing away your fish oil. Omega-3 is not the villain. In fact, for most people, omega-3 from fish oil is one of the more reasonable additions to a heart-conscious lifestyle. But here's what nobody explains at the pharmacy counter, and what most people never hear from their own doctor because the appointment is too short. Omega-3, especially at higher doses, has a real documented effect on how your blood clots. It thins your blood, not dramatically, not like a prescription blood thinner, but enough that when you add it on top of certain medications, the effect stacks. And when the effect stacks, the risk stacks with it. The first medication I want you to pay close attention to is Warfarin, which many of you may know by the brand name Coumadin. Warfarin is prescribed to millions of Americans, especially those with atrial fibrillation, artificial heart valves, or a history of dangerous blood clots. It works by deliberately slowing the blood's ability to clot, and the dose is calibrated with careful blood tests. Now imagine you're on Warfarin, and every morning you add a high dose of fish oil because you read it was good for your heart. What you've done, without meaning to, is push your blood even further toward thinning. And when blood thins too much, it doesn't just prevent bad clots. It allows bleeding that shouldn't happen. Bleeding in the stomach, bleeding in the brain. And a bleed in the brain, my friend, is a stroke. Not the clot-type stroke people usually fear, but a hemorrhagic stroke, which in many cases is even more devastating. This isn't me speculating. Major medical references, including the Mayo Clinic and the National Institutes of Health, list this interaction clearly. It is a known clinical concern. Now I want you to do something right here with me. Put your hand flat on your chest, right over your heart. Feel that rhythm. That steady beat is the result of a system that depends on balance. Balance between pressure and flow. Between clotting enough to heal a cut, but not so much that a clot blocks an artery. Between thinning enough to keep blood moving, but not so much that a vessel leaks. Every single medication, every single supplement you take either supports that balance or disturbs it. And when you stack 2 things that push in the same direction, the balance tips. That's what we're talking about today. Not poison, not conspiracy, just balance. And the quiet moment when it's lost. The second medication I need you to know about is Clopidogrel, known widely by the brand name Plavix, along with its cousins in the antiplatelet family, including good old aspirin taken daily for heart protection. Millions of people over the age of 60 are on some form of antiplatelet therapy. Maybe you had a stent placed. Maybe you had a minor heart event years ago, and your doctor told you to take a baby aspirin every morning for life. Maybe you're on Plavix after a procedure. These medications work differently from Warfarin. They don't slow the clotting cascade. Instead, they stop platelets, the tiny cells that rush to plug a wound, from sticking together as easily. And here's the thing almost nobody tells you. Omega-3 at higher doses also has a mild antiplatelet effect. So when you take fish oil on top of Plavix, on top of aspirin, you're asking your platelets to do their job with one hand tied behind their back and then tying the other hand too. For most people, a modest dose of fish oil combined with a baby aspirin is not catastrophic. And I want to be fair about that, but for older adults, for people with fragile blood vessels, for people who also have uncontrolled blood pressure, The combination becomes a real conversation to have with your doctor, because the bleeding risk is not theoretical. It's documented. It's in the prescribing information of prescription omega-3 products. It's discussed openly in cardiology guidelines. And yet, how many people in your life are swallowing fish oil capsules every morning without ever mentioning it to the doctor who prescribed their blood thinner? Probably. Most of them. And this is where I want to pause and ask you something honestly. When was the last time you sat down and actually told your doctor every single pill, capsule, and supplement you take? Not just the prescriptions, the multivitamin, the turmeric, the fish oil, the garlic tablets, the vitamin E, all of them. Because here's a hard truth from someone who has read a lot of medical histories over the years. Most people leave supplements off the list. They assume that because something is sold over the counter, because it's natural, it doesn't count. And that assumption is exactly where silent danger grows. If this is starting to make sense to you, if you're sitting there thinking about your own medicine cabinet or about your mother, your father, your spouse, do me a favor right now. Hit that subscribe button, hit that like, and leave a comment below telling me your age and where you're watching from. I want to see who is listening, because I read these comments and the stories you share shape the topics I cover. Tell me your age, tell me your city, tell me if you or someone you love is on a blood thinner and also takes fish oil. This matters. Your voice on this channel matters. And listen to me carefully right now. If you know your cholesterol has been creeping up, if your last lab work showed numbers your doctor frowned at, if you have a family history of heart attack or stroke, I've put a link in the very first spot of the description below. It leads to a complete method designed specifically for people who want to protect their heart, bring their cholesterol back into a healthier range, and reduce the silent progression of cardiovascular disease, the kind that leads to heart attacks, strokes, and the kind of sudden event that changes a family forever. Please, don't scroll past it. High cholesterol doesn't announce itself. It doesn't give you a warning the day before. By the time the artery closes, the damage is already done. Tap that first link. Read what's there. Even if you do nothing else today, at least know what's available to you. Now let me bring you back into the conversation, because I haven't told you the full picture yet. Here's something that most people don't realize about stroke. A stroke is not one single type of event. There are two main kinds. The first is ischemic stroke, where a clot blocks an artery feeding the brain. The second is hemorrhagic stroke, where a blood vessel in the brain ruptures and bleeds. Medications that thin the blood protect you from the first kind. That's their entire purpose. But they can increase your risk of the second kind, because a thinner blood supply means a weaker response when any tiny vessel starts to leak. Now, when you add omega-3 on top of warfarin, or on top of an antiplatelet, you push further into the bleeding risk side of that equation. For a younger person with healthy vessels, this shift is usually small and manageable. For an older person with years of high blood pressure, with arterial walls that have lost some of their elasticity, with perhaps a small aneurysm nobody has detected, that shift can be the difference between a normal morning and a phone call no family wants to receive. I'm not saying this to frighten you for no reason. I'm saying it because knowledge is the only real protection you have. Let me give you something practical you can do today. Something simple I tell my own patients. The next time you pour a glass of water in the morning, before you take any pill at all, I want you to lay every single thing you're about to swallow on the counter. Every prescription, every supplement, every over-the-counter tablet. Look at them, count them. Then ask yourself one question. Does my doctor know about every single one of these? If the answer is no, even for just one, you've found your next phone call. Make an appointment, bring the bottles, not a list on your phone, the actual bottles, because the dose matters, the brand matters, and the other ingredients matter. This one habit, this one small act of transparency, has probably prevented more hospital visits than any single medication I could prescribe. Now here's the question I really want you to sit with. Why is it that we trust a supplement we buy in a bright yellow bottle more than the medication a cardiologist personally wrote for us? Why do we question the prescription, but never question the capsule? I think it's because the word natural has been repeated so many times that we've stopped thinking about what it actually means. A substance can be natural and still interact with your body in powerful ways. Foxglove is natural. Hemlock is natural. Dose and context are everything. Omega-3 is a helpful nutrient in the right context and a risk factor in the wrong one. That's not opinion. That's pharmacology. And before I keep going, quick reminder. The first link in the description is still there for you. If you want to take a closer look at the method for protecting your heart and keeping your cholesterol in check, it's right at the top. Tap it whenever you're ready. Before I close, I want you to understand what I'm really asking of you today. I'm not asking you to stop taking fish oil. I'm not asking you to panic about your medications. I'm asking you to have one honest conversation with your doctor about the complete picture of what enters your body every single day. I'm asking you to stop separating supplements from medications in your mind, because your body doesn't separate them. Your liver processes them together. Your bloodstream carries them together. Your heart responds to them together. And if you're over 60, if you're on Warfarin, if you're on Plavix, if you're on daily aspirin, that conversation is not optional. It is, in my clinical opinion, one of the most important conversations you can have this year. If this video has helped you understand something you didn't know before, please subscribe to the channel. It costs you nothing. And it tells the algorithm to bring this kind of information to more people who need it. So here's what I want you to take away today. Omega-3 is not your enemy, but Omega-3 combined with Warfarin and Omega-3 combined with Clopidogrel or daily aspirin is a combination that deserves your attention and your doctor's attention. Don't stop anything on your own. Don't adjust doses on your own. Don't assume silence from your pharmacist means safety. Bring the bottles. Ask the questions. Demand the clarity. Your heart has been beating faithfully for every single day of your life without asking for anything in return. The least you can do today is give it the respect of a careful, honest look at what you're asking it to handle. If this message reached you in time, share it. Send it to your mother, your father, your husband, your wife, the neighbor who takes 8 pills every morning and doesn't know why. Subscribe, like this video. And I'll see you in the next one, because there's still so much I want to tell you about protecting the one heart you were given. Take care of yourself. I mean that.